Hi, I'm Dr. Kelly Birkenstock, President of Skin Body Health in Mandeville, Louisiana and New Orleans, Louisiana. We also do our live conferences and visits to Alabama and Florida where we're licensed also. We can help anyone nationwide via our teleconferences and Zoom conference, and we're happy to help anybody. We come to you and we speak to you about anti-aging, hair restoration, Botox, fillers, and things about skin, menopause, and andropause. What is andropause? That is when men go through the time of life known as andropause or male menopause. Tonight we're going to be focusing on rosacea, and both men and women do get rosacea, and they both get it in the older points of life. So usually after the age of 30, but even more frequently after the age of 50. But what exactly is it? Well, it's an overproduction of the inflammatory mediators, and it's also found more likely in people of Irish, English, or Celtic origin, light-skinned people, pale people, those with a slightly red tint or hue to their skin. That doesn't mean it can't happen to anybody else, and it certainly does, but those people predominantly, we know they're probably in line to get it, or at least 10% of all of those of that origin. 10% of the total people in the United States. But so we know it's from an overproduction of inflammation or inflammatory mediators. It's also an increase of demodex or demodex mites. And that sounds kind of really weird, but yes, everybody has little bitty tiny mites or parasites that live on our skin. It's not a nice thought, and it's totally normal, but they all do live there. So how can we get rid of these things? Well, there are ways to get rid of them. Also as we get older, all of this damage, as we're talking about the overproduction of inflammatory mediators and the little bitty mites, they can lead to pustules and pastules, where you can also get redness and inflammation. So that can be caused to a damage to the skin barrier from epidermal or skin water loss. So after we go through menopause, or as we're getting to menopause, perimenopause and beyond, the estrogen or lack thereof decreases the hyaluronic acid to the skin, which is our normal moisturizer. So we get a decrease in natural loss of water to the skin, which can lead to redness. Also, with that decrease in estrogen in male and female, we get an increase in vasodilation, or the little blood vessels start swelling. And when that happens, we can get a big puffy red clown nose, little tiny spider veins across the face, and actually a thickening of the skin, which really isn't pretty. So what causes some of this? Well, as we had said, some of it hereditary, but also spicy foods, hot foods, caffeine, the sun rays, leaky gut, stress, temperature changes, and alcohol. So there's so many things that can kind of align ourselves this way, but when we know what some of these items are, perhaps we can mitigate or even remove some of them from our lifestyle. If we're talking about leaky gut, we know there's probably a bacterial overgrowth. If not just in the gut, then also in the small intestine and or colon. So we need to treat this bacterial overgrowth. So what would we treat that bacterial overgrowth with? Well, that could be things like kefir, kombucha, sauerkraut, apple cider vinegar and water, and lemon or lime water. Things that are going to calm down that leaky gut and tighten it up so that we're not so inflamed, which is going to cause vasodilation in the arteries all around the body, but especially in the little tiny ones in the face and the neck and the chest. Well, what about those little mites we were talking about? The little bitty tiny mites on the face. We didn't know this. This is sort of new research. What we now know is that medicine that we've all heard about probably in the last 2 years, and it sort of sounds scary, ivermectin. Well, yes, ivermectin is used for horses and cows, but guess what? It's also a dermatologic cream. And when you use tiny amounts of it on the face, it kills these mites. These are the mites that are causing rosacea and acne, and we don't want them to be there. So little tiny amounts of ivermectin has actually been shown to be superior or better than Flagyl or metronidazole. Metronidazole is the chemical name of Flagyl, and that comes in cream and oral forms that we can swallow. So does ivermectin. But the ivermectin is actually really great for these little tiny mites on the face. And you can find that in PubMed, so this isn't some woo-woo medicine. This is actually real stuff. In terms of the sun, what can you do? Well, you want to get a good sunscreen. You always hear me talk about the sunscreens that I don't like, that have avobenzone and PABA and all these other things. But since when you're in a rosacea and or acne mode and you're more sensitive to sunscreen, better to use titanium and or zinc. Those are your better sunscreens. They don't break us out. They calm down the skin. So when you've already got an inflamed position, you don't want to inflame it more. So let me take a break and say that we have our YouTube channel, Dr. Birkenstock Skin Body Health. We come to you every week and we talk about different things with anti-aging, skin, rosacea, hair restoration, and the like. And we tell you what you can do to help prevent these things and or support vitality and longevity. So please check our YouTube channel, like and share so that we can get you as part of our normal tribe, because we love to have you. You can also click in the link in the store below to see our store, skinbodyhealth.com. So talking about a store, what exactly will we talk about tonight? What could be good for rosacea? Well, we want things that are anti-inflammatory, or in other words, that decrease inflammation. What increases inflammation naturally? Omega-6. So even though omega-6 is a part of our plants and such, we don't really want those in terms of excess, because they lead to pro-inflammation, not only in the body, but also on the skin. So too much omega-6 can lead to pro-inflammation in the skin. So we would want omega-3. So in omega-3, this is our Skin Body Health omega-3 called Omega Pure. And with that Omega Pure, you're getting a very, very high EPA and a high DHEA. High DHEA is good for the eyes and the hair. High EPA, great for the brain and the skin. That high Omega Pure, omega-3, is anti-inflammatory, pushes the inflammation down, improves leaky gut, improves skin tone, improves rosacea. And it's nature's gift. So we hope you find some liking there. We also have a skincare topical product which has got adaptoline and adaptoline, benzoyl peroxide, and clindamycin. This is a great topical for those who have moderate to heavy rosacea with pustules and papules and or just acne. So it's a great overall treatment. If just the telangiectasias and the redness and or veins were your issues, we might guide you differently. But, and again, leaky gut is part of this whole phenomenon. We've known about that and we know what to do. We want to tighten that leaky gut. But for sure, do it with kefir, kombucha, apple cider vinegar, sauerkraut in your foods. Avoid processed foods, so the cookies and the cakes and the fried foods, which are going to lead to a leaky gut problem. Leaky gut leads to skin problems and brain problems. So what can we do to tighten the leaky gut? Pre-probiotics, Omega Pure 3, and then topically our adapalene, benzoyl peroxide, and clindamycin combination. So for the two natural items, our omega-3 and our pre-probiotics, we're going to discount those 20% for the next 2 weeks. So throughout April. This is available by prescription only in our clinic. It's our Eliminate prescription. And again, it's got benzoyl peroxide, adaptoline, and clindamycin. And we're happy to prescribe and help you with that if it may need be and if it's precise for you. So we want to watch those pro-inflammatory foods, as I was speaking of before. And that would be anything in a can or a box or a lot of things that you might order from a restaurant. So what would we want instead? We want to increase cold water fish, which decreases inflammation. So, things like salmon, mackerel, tuna. Primrose oil is another great oil that is absolutely decrease in inflammation. So what could we be doing in our life that could actually aggravate inflammation besides the foods and besides what we're putting on our skin, besides the loss of our natural hormones through menopause? Well, it could be those PPIs. What are PPIs? Those are things like Prilosec, Nexium, propranolol, Protonix, Zegrid. Those are the proton pump inhibitors, PPIs, that take the acid out of the stomach when we've got an ulcer or an upset stomach or gastritis. Those were only meant to be used for 2 to 6 weeks. Unfortunately now, it is because they've become over the counter and such, they've become something that have been used for years and years and years. That is not doing anything good for us. Our stomach is supposed to be acidic. It's not supposed to be alkaline. So when we're blocking all these acids, then we're blocking acids in the small intestine and then later the large intestine, and can lead to small bacterial overgrowth and all kind of other disastrous things. So if you're walking around bloated all the time with a lot of obnoxious gas, it could probably be because you've got small bacterial overgrowth and or a very alkaline gut, stomach, which is not healthy. So you need to increase the acid and acidity in the gut. So perhaps with betaine hydrochloride, we can tell you more about that on an individual basis, or apple cider vinegar, lemon water. But the worst thing we want to do is to block all the acid in the stomach. Feels good today, hurts long run. Causes osteoporosis, a decrease in magnesium, decrease in B12, decrease in zinc, increase in pneumonia, and increase in irritable bowel syndrome. I want to lose my bones off of an acid blocker? No, we absolutely don't. We can find other ways to heal the gut. Short term, fine, yes. And then if you're having trouble getting off these agents, go see your doctor so we can show you how to wean down slowly and to incorporate more acidic substances. I know it sounds harsh, but it absolutely will be the cure for you and will make you feel better. So leaky gut is a big old deal when we're talking about rosacea and acne in the menopause and andropause age group. What immediate treatments do we have? Revolutionary breakthroughs. We've almost got the cure. And what that is our 1726 acne laser. Our 726 laser, part of my Acne Clear, Dr. Birkenstock's Acne Clear program. It's the Aviclear laser, laser length 1726, which has not been known in the United States before. It's been out 2 years in Milan, Italy. It absolutely targets the sebaceous glands and the hair follicles where these propiona bacteria and mites live. And it's zapping them towards cure. It takes 3 treatments, 1, 2, 3, 1 month apart, and you're going to see substantial clearance in your acne and or rosacea problems. Well, do we do just that? Yes, by and large we do. However, we analyze you on a one-to-one basis. And if you got extremely mild, we get through the 3 Acne Clear, Aviclear 1726 lasers, and it's a done deal. If you've got moderate or modest or even more severe acne or rosacea, adult acne, adult rosacea, or even teen acne, we're going to prescribe a custom program for you. Maybe some things to tighten up that leaky gut. Maybe some topicals. Maybe even ivermectin cream, depending on whether or not we think you've got a heavy mite count, depending on how it looks under facial analysis. And we're going to set up for you a rosacea and an acne clear program. I'm so proud to bring this to you. In addition to that, if you are menopausal, and it's appropriate treatment for you, we're going to add in the good estrogens, E1, E2, bioidentical hormones, the testosterone, DHEA, and progesterone, and you're going to be clear skin, beautiful skin, rid of the acne and rosacea, or at least remediate it as much as possible. As always, it's such a pleasure to talk to you. If there are any questions, please, you can email us at info@skinbodyhealth.com. That's info@skinbodyhealth.com. You can also text us 985-727-6985. 888-726-7676. That's our main number in Mandeville, Louisiana, but I'll repeat it. That number is 985-727-7676. So just to recap, tighten up that leaky gut for healthy skin. Feed yourself omega-3 fish oils for that healthy skin. Do the treatment with us. Acne Clear program with AviClear, Acne Laser 1726. There's never been another laser like it. It's cutting edge for 2023, and we hope to see you on the other side. It's been my pleasure talking with you tonight. Good night.